Fireside Chats. Welcome to the first one of 2025. So today we're going to be chatting a little bit about autoimmune disease. This was a heavily requested topic. Autoimmune diseases are extremely complex. And so I've done my very best to simplify it and make it as user-friendly as possible. So this is me. Hi, I'm Aleena. I'm a family doc here in Huntsville. I've been here for just about 3 years now. I am a mom to 4 fur babies. So Henry is on your left. He's our dog. And then from left to right, respectively, we have Louie, Finnegan, and Harvey. And this is me and my best friend dressed as kidneys for Halloween. What I would like to accomplish today is helping you guys understand what the heck is an autoimmune disease. I think this term is thrown around a lot, but people don't always actually truly understand and appreciate exactly what this means. I want to explain a little about why they happen. Why do our bodies betray us and start attacking themselves? Some signs and symptoms and the difficulties that kind of underlie trying to diagnose some of these conditions. And then treatments and hopefully, some future research and what kind of the new cool autoimmune things are that are coming down the pipeline probably in the next few years. So a normal immune response. I think in order to really appreciate and understand what an autoimmune disease is, you have to kind of understand what it should be doing. In a normal immune response, what happens is this. Each of our cells, we are all individual. They all have markers on their surface that designate them as self. So my cells have something different than your cells, who has something different than your cells. But the creative part is that our immune system is able to look at all of our own cells in our body and say, this is me. I'm not going to attack you. And that's what should happen. So as you can see here, our little all cell in body, which is in blue, and our immune cell, which is in orange. Their markers kind of fit together like a little puzzle, and that makes our immune cell very happy. It says, hey, you are the VIP, get on through. And those immune cells really act like a bodyguard. So imagine you're like in line at a club, they're the bouncers, and they're kind of there saying, hey, you're cool, get on in. But what happens when a foreign invader shows up? Dun, dun, dun. Invading cells or viruses or whatever it may be, they don't have these self markers. They have different markers on their surfaces. And that is how our immune system recognizes things that are not supposed to be there. When you have a virus or a cold, you get ill, you get fevers, you get runny noses and symptoms, and your body is doing its best to fight off that virus. So as you can see, this very angry looking virus, the markers on its surface are very much not really fitting with the markers that are on the immune cell. And so our immune cell goes, what the heck is this? And then it rallies the troops, and it is very smart. It sends signals to all the immune cells in your body, and they all kind of aggregate together and just go to town on these like viruses and bacteria. Our immune system is so clever, but it's so complicated. It can go wrong. And that's when you get autoimmune disease. It's when your immune cells start recognizing your own cells as a foreign invader. It's looking at your own surface markers on your cells and it's saying, this isn't me, and it starts attacking it. So it's like a bar fight gone wrong. And that is when this becomes a problem. All of our tissues, all of our different organs, they're all very unique and they all have different self markers on them. You can have an autoimmune disease against your thyroid. People who have hypothyroidism, where their thyroid is not functioning because Our immune cells have attacked that thyroid tissue and destroyed the functionality of that organ. But it doesn't affect other places in the body, it just affects your thyroid. These autoimmune diseases can be targeted to specific organs. And that's why, you might have hypothyroidism or multiple sclerosis, where our immune system is attacking our central nervous system, which includes our brain and our spinal cord. The self markers that it's identifying as not self are what's kind of being targeted. But some of them manifest very much as whole body sort of diseases. And we will talk a little bit about that. We'll discuss what some of these common ones are. So, as you can see by this little pictogram, joints can be affected. So, those who have rheumatoid arthritis, it's an autoimmune disease against the tissues that reside in our joints. We can have autoimmune disease against our muscles, our skin, so like psoriasis and eczema, for example, digestive system, so Crohn's and ulcerative colitis. And then, of course, our thyroid and our nervous system. So that would be things like hypothyroidism and MS. This is the part that becomes a little bit tricky, and that is the signs and symptoms of autoimmune disease. The challenge with these is that the signs and symptoms of autoimmune disease are extremely vague. And that is why it can be so hard to diagnose these things, because someone comes and they're just like, I'm tired. And I'm like, yeah, me too. Like, everybody's tired. But, that could possibly be a sign of an autoimmune disease, right? The kind of common early symptoms that we see are that kind of pathological fatigue. So, it's one thing to be exhausted, but it's another thing to just be like, wow, like I feel drained. And that can certainly be like an early sign or symptom before other things start manifesting. Achy muscles, fevers, chills. And you can imagine, when you're sick, you get a fever and you feel cold, and that's because your immune cells are releasing all these inflammatory markers to destroy viruses. Similar thing happens, but it's happening to healthy tissue. So you may get, recurrent fevers or those chills or muscle aches. And it's not necessarily because you're fighting off a cold or an illness, but it could actually be an autoimmune disease. People are having, intermittent fevers for prolonged periods of time. They just keep coming and going. There's no real rhyme or reason or pattern to these. Then maybe we need to look into this a little bit further. Swelling and redness, joint inflammation, numbness and tingling, that would be more common in something like multiple sclerosis, hair loss, skin rashes, and that's just to name a few. The reality of this is that any of these symptoms could be anything, but when we're kind of seeing them in combination, that's when it starts to maybe make us think a little bit harder about looking into autoimmune related conditions. It can sometimes take time to diagnose. So, type 1 diabetes is an autoimmune attack against your pancreas. So, you're not able to make insulin, and that's why they need to give themselves insulin needles. It's different from type 2 diabetes, which is more related to insulin resistance. So your body doesn't respond to the insulin, but you make insulin. So that's the distinguishing factor between the two. You can get like very extreme thirst, weight loss. That would be common symptoms of type 1 diabetes. It says irritable bowel syndrome. That's not actually an autoimmune condition. I just want to point that out. Inflammatory bowel syndrome, like Crohn's and ulcerative colitis, those are autoimmune. And then psoriasis and rheumatoid, which would be like skin and joint involvement. We will talk a little bit about why it is autoimmune disease happen. So genetics certainly play a role here. If you have a first degree relative with an autoimmune disease, you are much more likely to have one yourself. Mother, father, brother, sister doesn't mean you will absolutely get it, but it does make it much more likely that you may develop an autoimmune condition. If you have one autoimmune condition, you're more likely to get another. So then someone brought up the whole idea of environment, infections, chemicals, anything in our surrounding system can potentially trigger an immune response with COVID, which is a viral infection. So, what we see often with viral infections, they somehow trigger autoimmune disease. For some reason, they do a good job of looking like our own cells. Guillain-Barré syndrome, which is a autoimmune disease against your peripheral nerves. So that's like the nerves in your extremities and your legs. The first thing I ask someone when I'm suspecting that is, have you been sick recently? Because a viral infection can certainly trigger that. It can trigger autoimmune hepatitis, which is an autoimmune condition that attacks your liver. And then we kind of chatted about heavy metals and toxins. Pesticides, for example, high concentrations of pesticides can trigger these autoimmune responses, damaging your own cells in whatever form that may be. And then I put hormones here only because women are more likely to develop autoimmune disease. It's been studied quite extensively. It has something to do with, our biochemical makeup. What I can say is that women are more affected than men. How are autoimmune disease treated? We can't cure them. Once your immune system recognizes your cells as not your cells, you can't get rid of that because our immune system has an excellent memory. Think about when you get a vaccine. Why do we get vaccines? We get vaccines because we want our immune system to see that, create memory cells, so that the next time we're exposed, our immune system's all ready to get up and go and get rid of things before we even notice that they're affecting us. The same thing happens, though, in autoimmune disease. Once it recognizes the tissue as being bad, it will always recognize the tissue as being bad. There are many things that you can do to help to mitigate this. Lifestyle can actually play a really big role. Many people do have to, get onto some sort of immunosuppressant drug, which kind of dampens that immune response. Goes without saying, the healthy eating, the regular exercise, the stress management. I think what I would like to discuss today is why this actually works. With a lot of autoimmune disease, especially ones that cause quite a bit of pain, physical therapy and also psychotherapy are really important because half the battle is managing those kind of physical symptoms, but also the psychological impact that it has on people who suffer with these. It's not always easy. Sometimes coping will make your symptoms better. There's a lot of research out there that shows the correlation between pain and depression or other mental health disorders. And so when you're not well up here, you can't be well physically. And those two things really do tie into each other. So exercise and autoimmune disease. What I want to highlight here is how freaking cool our body is, because we have built-in mechanisms that help reduce our risk of not only autoimmune disease, but of cardiovascular disease, of cancer, and all of it comes down to the same thing: exercise. Why? Why does exercise do so much good for me? We know it does, but do we actually know why on the cellular level exercise is so beneficial? So, of course, it pumps up your muscles, your heart, it strengthens it, it allows your lungs to expand and take in more air, it allows your muscles to be strong. But what is it doing at the cellular level? And this is what's so fascinating. So when you exercise vigorously, so, not necessarily a meandering walk, but if you're kind of like breathless and giving it a good go, your body starts releasing these little proteins. We're going to call them cytokines. That's their actual name. But they have anti-inflammatory properties. They act like antioxidants. And so it helps to reduce inflammation. What's important to know is that inflammation is bad. Inflammation leads to cellular damage. Cellular damage leads to our cells not working the way that they should. What is cancer? Cancer is abnormal growth of cells. Inflammation can be directly related to that. And so, when your doctor says, you really got to quit smoking, you really got to quit drinking, you really got to exercise more, it's because smoking causes inflammation. Too much alcohol causes inflammation. A sedentary lifestyle causes inflammation. And to get those protective anti-inflammatory properties, all you got to do is move. How amazing is that? You don't need a drug. You don't need anything. Well, no alcohol or smoking, but hey, let's just roll with it. And then it decreases fat cells. So interestingly, fat cells cause inflammation. They release something called adipokines, we'll call them, and those are inflammatory proteins. So when you're exercising, if you reduce your overall adiposity or your overall fat percentage, you're reducing your risk of autoimmune disease and cancer and et cetera, et cetera, et cetera. You also pump your blood through your body when you're doing, dancing at the club, let's say. That's a form of exercise. And that helps to circulate all your immune cells through your body. It also promotes the production of immune cells. So as you exercise, you're boosting your immunity. And you will be sick less often because no inflammation or reduction of inflammation and this beautiful circulation of all your immune cells. And finally, we know that exercise really releases a lot of endorphins. It actually relaxes us and reduces our stress. By reducing our stress, we decrease something called cortisol, which is a stress hormone. And by reducing our stress, we reduce inflammation. There's a pattern here, right? It also triggers, after you've done your exercise, it actually allows your body to flip into using what we call our parasympathetic nervous system. And that's just a fancy way of saying it's our rest and digest nervous system. So when we're running from a bear, that's a real thing here in Muskoka, or moose, which are arguably more terrifying. We're kind of like in our stress mode. We're like running faster than we've ever ran before. And you're like, I don't know how I'm running this fast. That's pretty amazing. I can lift a car. That's our sympathetic nervous system. That is our fight or flight nervous system. Our parasympathetic nervous system, that's our rest and digest nervous system, turns on when we are relaxed. It brings down our blood pressure. It brings down our heart rate. It allows us to focus our energy and our blood flow on our intestines so that we can digest all our food and soak in all those nutrients. That is also kind of like, if you will, this is a very simplistic way of putting it, but it's kind of like our anti-inflammatory nervous system. If I haven't convinced you yet, I hope I can by the end of this slide. Exercise makes you sleep better. When you sleep, you can enter your restorative sleep cycle. When you are in your restorative sleep cycle, guess what goes down? Everybody all together. Inflammation. Oh, I was really hoping that would work. It keeps joints flexible, especially, when there is joint involvement. So lupus, rheumatoid arthritis, those kinds of conditions. really, really important to keep mobilizing, because that will ultimately reduce pain and reduce discomfort in those areas. Increases energy level. So when you exercise, you feel good. You get more energy. I'm usually a blob when I go home, but if I go to yoga before I go home to blob, I go home and I don't blob. It promotes growth of beneficial gut bacteria. The gut microbiome is kind of like a big thing right now. I think probably most people have heard of that at some point, but our gut harbors all this bacteria. It's supposed to, and there's good bacteria and there's bad bacteria. And so when we exercise, it actually promotes the growth of the good bacteria, which is like crazy. How do our bodies do this? I don't even know. But there's great evidence and systematic reviews that show this. And we're going to talk about that a little bit later, because it's very fascinating. So I think this is an important slide, because what about natural supplements? There's a lot of interest and, focus on naturopathic medicines and supplements and what have you. And, I think it's important to know like what you should and shouldn't do if you have these conditions. So all of these are based off of systematic reviews and extensive studies that have looked into each of these supplements. When it comes to autoimmune disease, vitamin D might make it less likely. Not really overly convincing. Vitamin C, it might make it better. So basically, when they say it might, it's because some studies showed that it did and some showed that it didn't. I bolded here curcumin, and this is a derivative from turmeric. And I think like a lot of people know about turmeric, but this is like a spice that you can get, comes from like a root. And this actually has anti-inflammatory properties. And there's evidence to support this. It reduces inflammation in the body. And also it does not cause harm. There's no side effects. So this actually there's evidence for this. And I wouldn't have a problem telling my patient, yeah, get the turmeric capsules. It probably will help. And it does for a lot of people. The other thing as well, and it's important to know, because I think like it's very easy and accessible for us to walk into a pharmacy and, buy over the counter supplements and think like, oh, it's natural and it's good for me. And, I'm doing the right thing by taking these vitamins and et cetera, et cetera. But there are specific herbal supplements that actually can worsen autoimmune disease. So please, 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 before you start taking anything, talk to your doctor, because sometimes these things can cause harm, and it's important to know about that. So I've highlighted just a few that it's from the Rheumatologic Association. This is all based off concrete, well-studied evidence. These are kind of some of the things that can trigger a flare of your autoimmune disease. So spirulina, elderberry, echinacea, alfalfa. Those are the 4 that are actually shown to increase the risk of triggering a flare. So yeah, the take home from this slide is that when it comes to natural supplements, the one that has been studied and shows that there's evidence for reducing inflammation is turmeric. And so it doesn't mean that other things don't reduce inflammation, but we don't have evidence to support it. And so, we can't recommend these things when we don't have the studies to back it up. But this is one thing that does have evidence and is safe for you guys to take. So living with an autoimmune disease, I think what's important to know is that many people can live a full, healthy, normal life. The degree in which an autoimmune disease affects someone varies substantially from person to person. Some people don't need to be on any medications, and they can manage things with lifestyle alone. Some people need the additional help, and it all depends on how severe that immune response is that your body is kind of initiating. And it's really important to have support from your family, your friends, your doctors, uh, in kind of getting help with managing these and coming up with strategies. Like I alluded to earlier, our gut has bacteria in it. It's a balance. It's like a forest of bacteria, which sounds really gross, but there's a lot of really helpful bacteria. But there's also bad bacteria. And so, our body does a pretty good job of keeping a good balance and, making the good ones come out on top. What we are finding is that if you have too much bad bacteria in your gut, that can leak into your bloodstream and cause an autoimmune disease. Your gut microbiome can influence the development of an autoimmune disease. And so balancing good and bad bacteria is really important, because if that's disturbed, it can cause the immune system to become overactive or confused. There's a lot of research going on in this topic right now. We don't fully understand it. I don't think we know exactly how we're going to utilize this information at this point, but stay tuned, because I think this is going to come up not just for autoimmune disease, but for a lot of other diseases as well. We're learning that there's such a big link between our gut health and our overall health. So happy gut can support a balanced immune system. And what did we learn earlier? We learned that exercise can make the good bacteria flourish, but it's also making your gut health better. Like, what? Amazing. And so we're really spending a lot of time in research. We're, as if like I'm doing this. I'm not, but people much smarter than me are spending a lot of time researching and trying to understand the intricacies of how this actually happens and how this works. And so, there might be some evidence for probiotics and things like that for maintaining gut health and helping in prevention of some of these conditions. So without further ado, these are my key takeaways, is that autoimmune diseases happen when the immune system attacks healthy cells by mistake. There are many types, all of them affecting different organs and tissues. And even though there's no cure, there's a lot you can do from a lifestyle standpoint. And also, of course, medications that help suppress the immune system that can really improve quality of life. And there's a lot of really exciting research underway to better understand autoimmune disease and how we can help not only treat them, but also prevent them. So thank you guys so much for your time and your questions. That was awesome.